Hi, I am Mr. Sarvasai. In this video, I demonstrate you the palpation of the liver. It is very important because it is commonly given short case in medicine exam. So, like other examination, it is started your examination with greeting, introduction, consent and exposure. For liver palpation, you have to expose from mid chest to mid thigh. And I already take his consent and started my examination. For liver examination, you just kneel down side of the bed and then roll the face of the patient to the left side and ask the patient to take deep breath and ask to relax his abdomen. And then your hand position, your wrist, your hand, your wrist, your elbow and your shoulder should be in the same plane. Your hand, your wrist, your elbow and your shoulder should be in the same plane. And then your tip of the finger are parallel to the lateral border of the rectus abdominis muscle and radial border of the index finger parallel to the costal margin. So you just place your hand and then start palpation from the right iliac fossa. Ask the patient to take deep breath. Give pressure during expiration and sustain the pressure during inspiration. Try to feel the liver, try to palpate the liver by your radial border of the index finger. Pressure during expiration and sustain the pressure during inspiration. Pressure during expiration and sustain the pressure during inspiration. So we just palpate 6 areas. 1, 2, 3, 4, 5, 6. And then you go for upper part of the liver dullness. For upper part of the liver dullness, find out the sternal angle and then parcus. So count the intercostal spaces, second, third, fourth, fifth and sixth. 6 intercostal spaces. So this is all about examination, palpation of the liver if the liver is not palpable. If the liver is not palpable, you just complete your examination like this and tell your professor, present your case like this. Liver is not palpable and upper part of the liver dullness found in the 6th intercostal space. Now I demonstrate you if the liver is palpable, what you have to do. Suppose liver is palpable here. Then you go for several things such as started your palpation with measuring the liver. Then you go for margin. Then you go for surface. Then you go for consistency. Then you go for tenderness. And then you go for upper part of the liver dullness. And then you go for hepatic bruit. So I just started with measurement. For measurement, you just measure from the mid-clavicular line from the costal margin, in the mid-clavicular line from the costal margin. First of all, measure it. And then you go for margin. Whether the margin is regular or irregular. Then you go for surface. If the surface is smooth or lobulated. And then you go for consistency. Is the consistency soft or firm or hard. And then you go for tenderness. Press over the liver and see over the face of the patient, is there any change for tenderness. And then you go for upper part of the liver dullness, which I demonstrated you. And lastly you go for hepatic bruit. Hepatic bruit found in case of primary hepatocellular carcinoma. So this is all about the examination of the liver when the liver is palpable. So how you present your case? Suppose the liver is palpable, how you present your case? On my palpation, the liver is palpable 8 cm from the costal margin in the mid-clavicular line. The margin is regular, surface is smooth, consistency is firm and it is not tender, and upper part of the liver dullness found in the 6th intercostal space and there is no hepatic bruit. So this is all about examination of the liver, palpation of the liver, and thanks for watching.